in my final year, and my work looks at how the types of foods that we eat in our diet influence our risk of metabolic disease. And I specifically look at the liver and the heart and how they interact. And a lot of my work looks at running clinical trials or taking people, putting them on a diet and seeing how they respond. So we run a lot of interventions, and that's the kind of work that we're going to be mostly discussing today. So in today's presentation, we're going to initially start out by talking about what are metabolic diseases. Then we're going to move on and discuss a little bit about various risk factors. What does a risk factor mean? And then for the bulk of our kind of presentation today, we're going to be talking about how certain risk factors like the diet are related to certain metabolic diseases. And we're going to look at how we can break these risk factors down and see how different aspects are relate to metabolic diseases. And then towards the end of the presentation, I'm going to give you some future directions. So if you're interested in this topic, what to go read about and kind of where it branches out, but then also some unanswered questions in the field and kind of where the research is heading. So at any point, if you guys have any questions, feel free to put them in the chat. This is a relatively interactive presentation that I have, so there'll be a number of times throughout where I'll be asking you how things change, if they increase, if they decrease, if you don't think they change, or I'll be asking you just to list off things that may come to mind. So if you can, I encourage you guys just to participate in the chat, or if not, just have a think to your head before we carry on. So starting off the presentation and talk, I mentioned we're going to be discussing metabolic diseases, but we need to know what they are first. So the first question I have for you guys is, what is a metabolic disease? Can you come up with a definition of what this is? So I'll give you about a minute to either type it out in the chat or just kind of write it down on a sheet of paper that you have. Yeah, so we're starting to get some answers in the chat. One of them says it's a disease or a group of diseases which affect chemical reactions in the body or the speed at which chemical reactions happen. And that's along the right lines. So metabolic diseases are a group of metabolic conditions that are characterized by a disruption in how the body liberates or frees energy fuel sources, how it stores them, how it transports them between different organs, and at the end of the day, how these organs use this energy for, use these foods for energy. And when we talk about energy, we very often mean food or macronutrients or foods, things like sugars and fats. And then the next question I have for you guys is, these metabolic diseases, what organs do they usually affect? So if we're thinking about organs that are freeing energy, storing energy, and using energy, those are the ones that we have in mind. So we're getting answers like the liver, various glands, so there's generally about 5 major organs that we think about in the context of metabolic disease. One is the liver, because this is the organ that orchestrates the metabolic response to the meal and to the fasted state. It responds to insulin, for example. It stores fat and it stores sugar as glycogen. The yellow kind of blob at the bottom there is supposed to be fat tissue, which is a major storage organ in our body. And then we have the heart and skeletal muscle, which are big organs that use up a lot of our energy. The heart is continually beating, so it needs a steady supply of sugar and fat. And the last kind of red thing on the right there are our blood vessels. And very often, if we get disease, we can get a buildup of plaque in the blood vessels, which can lead to heart attacks or strokes. But then also various diseases like hypertension or blood pressure can affect the blood vessels, and they are major metabolic organs because many of these blood vessels are lined by a layer of muscle that, again, needs a lot of energy in order for it to carry out and do its job. So what are some examples of metabolic diseases with that in mind? we've kind of discussed what organs are affected. I've given you an idea of what's included. When we are now starting to discuss metabolic disease, are there any medical conditions that come to mind? And I'd probably say there's a list of about 12 various diseases that could kind of fall into this category. So I'll give you guys a couple minutes just to think what could come in. So one answer we've gotten is autoimmune diseases. Although some autoimmune diseases are associated with changes in metabolism, autoimmune diseases tend to be their own kind of major category, just like metabolic diseases tend to be their own major category. So there's a bit of crosstalk in what might be happening, but autoimmune disease is its own kind of big separate presentation and talk. Diabetes is definitely one of them. So kind of a short list of what we sometimes think about when we're talking about metabolic disease is things like obesity, diabetes, coronary heart disease. We get that buildup of plaque in the blood vessels, hypertension or high blood pressure. Dyslipidemia is a medical condition that's where your blood lipids are outside the normal range. So if people talk about having high cholesterol or bad cholesterol, that is another way of describing dyslipidemia. And then there's fatty liver disease. These are normally the classical conditions that we think about when we list metabolic disease, but there's also other conditions like stroke and heart failure, diabetic cardiomyopathy, which also are increasingly becoming recognized as different medical conditions that fall under this umbrella term of metabolic disease. And if you see what conditions are listed here, a lot of them tend to affect either the heart, the liver, the blood vessels, which we discussed in the previous slide. So for this presentation, I said we're going to talk about metabolic disease, but as you guys can see, this is a pretty big list with different conditions that are related but different. And so we're going to specifically, I'm going to come back to him in a sec. We're going to specifically talk about fatty liver disease today. And with respect to fatty liver disease, we're going to talk about factors that lead to an increase or a decrease in how much fat is stored within the liver. So we're talking about liver fat accumulation. When we start talking about diet and other risk factors in metabolic disease, they could affect some of these other diseases differently. And I think this presentation would very quickly spin out of control. So I've tried to really narrow it down just to this one medical condition and specifically fat accumulation. I put in gray at the bottom something called the inborn errors of metabolism, which you may come across in your A-levels reading about. And these diseases are metabolic diseases to a certain extent, but they're somewhat different to what the list that I put here. So inborn errors of metabolism are a group of genetic diseases where you have a mutation in a single gene that affects a protein that's involved in a certain metabolic pathway. So these conditions tend to be single point mutations that have a very specific individual cause, and they affect a very specific process, like how we store glycogen or how one chemical is converted to another chemical within a cell. These inborn errors of metabolism also tend to affect a slightly different group of organs. They tend to affect organs with a very big metabolic demand. So things like the brain, the eyes, and the heart, and they present very early on in life. So before somebody is born or kind of in the first couple of years of life. If you look at this other list, such as obesity, heart disease, high blood pressure, it's a bit of a different picture. Although there are still changes in the person's metabolism, these medical conditions tend to present later on in life, usually after the age of 40. They tend to affect a different group of organs. And if there is a genetic cause, it isn't as much of a single gene, more a group of genes or a group of genetic polymorphisms that all together increase someone's risk of developing the conditions. So although both inborn errors of metabolism and this other list of diseases are metabolic diseases, I just wanted to put that clarification in there in case you come across that in any further reading. If you have any questions about that, feel free to ask. So we've kind of discussed what metabolic diseases we're going to look at today, specifically fatty liver. Now we're going to move on to risk factors. So again, how would you define a risk factor? I think this term is very often used. It'll come across in physician offices, you'll see it on the news, it'll come up in social media. But what exactly is a risk factor? So we're having a couple definitions start to come up. Exactly. So I think we've got a few of the definitions coming up. So it is a parameter that increases your chance of developing a certain disease. So it can be something you control, like in your lifestyle, but it can also be things that you have no control. So looking at metabolic diseases then, my next question is, what are some risk factors? Can you guys come up with some examples? So certain things that increase your risk of developing things like high blood pressure or diabetes or fatty liver disease. And we're talking all metabolic diseases, not just fatty liver. So yeah, lifestyle, things like smoking, diet, activity level, these are absolutely on the list. Alcohol is another big one. So when we start talking about risk factors, there's a few classic ones that always tend to come up. And you guys got them off the bat. Diet, activity level, someone's age, someone's family history, or their genetics can influence their risk of developing a disease. And these were the ones that were very early on discovered in a lot of research studies or in a lot of longitudinal studies. And these are some of the ones that we discuss in clinicians' offices when we're talking with patients about managing their disease risk. But since then, there have been a number of other risk factors that people have started to identify. So other ones, as you guys mentioned, include things like smoking and alcohol, as well as someone's stress is a risk factor for disease. So if they're very high stress, they'll release more of a hormone called cortisol, which can increase a person's blood sugars, and that leads to an increase in their risk of developing type 2 diabetes. If a person is obese or has certain medical conditions, that can increase their risk of metabolic disease. And if we look at these diseases, there's a little bit of a continuum, as you guys may have observed. Someone can develop obesity, and that's a medical condition. But then having obesity is a risk factor for a number of other metabolic conditions like type 2 diabetes and fatty liver disease. And those are risk factors for developing further disease, such as heart failure. So it's a bit of a continuum where one disease can lead to the next, which can lead to a further one. And then a person's sex is also sometimes a risk factor for certain metabolic diseases. So being male increases your risk of cardiovascular disease, but it doesn't have an effect on your risk of developing type 2 diabetes, for example. So these are some of our classic risk factors. But again, I'm going to go one step further and say there's another group of risk factors that have been more recently identified in research that we sometimes are not thinking about in the clinic. So if we start on the right, there's really good research that's shown that someone's sleep habits and shift work can influence their risk of developing metabolic disease. So if someone doesn't sleep a lot, or if they're working shifts erratically, or has a disease that affects their ability to sleep, such as sleep apnea or obstructive sleep apnea, this can lead to an increase in their sympathetic nervous system signaling. This leads to blood vessels constricting. It can actually increase your risk of developing hypertension and later on heart failure. Pollution and environmental conditions are another risk factor. So people who live in higher pollution areas or come from lower socioeconomic status, these are both risk factors that can increase things like obesity or type 2 diabetes. Certain medications that people take are also risk factors, and sometimes you can control these medications and slowly come off them. But for some medical conditions, you have to be on medications for your entire life. And these medications actually end up increasing your risk of obesity, for example, or of high blood sugar, which then impacts your type 2 diabetes risk. And then interestingly, menopause is a risk factor that's recently come up as well. And it's been shown that after people go through menopause, coming out on the other end, that lack of estrogen leads to an increased risk of developing cardiovascular diseases, for example. So there's a lot of things here that can influence a person's risk of disease. And it's really tough because sometimes when you're in the clinic, or if you're interested in medicine and you're a physician, These are a lot of factors to balance, and some of these things we can change and some of them we can't. And I purposefully kind of have laid this out on a bit of a continuum from left to right, because some of these disease risk factors we can't change. So we can't change a person's genetics, we can't change how old somebody is. But on the right-hand side, these are risk factors that we can influence. So if any of you are interested in medicine, the things on the right are some of the risk factors you'd be discussing with patients in clinic about things to change. Because a person's activity level, whether they smoke, the diet they consume, these are things that we can modify, and these are risk factors that we can change. But even if there are risk factors that we can't change, like someone's genetics or their age, these are still really important to know because it gives us an idea of a person's baseline level of risk. Because if we know that someone has a very high baseline level of risk, we might give them medications earlier on than if someone has a lower baseline level. This is kind of the reason why if we're starting people on drugs that lower cholesterol, we don't really start people who are 20 years old on these drugs because we know that their risk of cardiovascular disease at the age of 20 is quite low. But the same person at the age of 65, for example, is a much higher risk. So although these risk factors are non-modifiable, they do still have clinical implications that we need to be aware of. So this is kind of the end of the broad disease risk factor portion of the talk. Going forwards, we're going to just discuss for the rest, mostly the effective diet. So we want to know how someone's diet influences their risk of fat accumulating in the liver. And the next question I'm going to ask you briefly is, how do we study someone's diet? If we think about it, diet is this big, complex conglomerate, but if we're going to organize a scientific study, we need to break it down into something measurable or something we can change. So what in a person's diet can we modify to look at our outcome, which is going to be liver fat? Exactly. So you guys are kind of getting, you're getting exactly what I wanted you to get, which is we can start looking at essentially how much they're eating or what they are eating. So quantity, when we start breaking this down, is going to be, we're going to be looking at the number of calories. So it's the number of calories someone consumes. And we can either look at studies where the intervention is hypocaloric. So these are studies where participants have consumed less calories than what they need metabolically, or hypercaloric studies, which are ones where they've consumed more calories than they need. In the second half of the presentation, we're going to move on to talking about composition, which you guys have started to address here. We can look at the macronutrients someone consumes, like sugar and fat, but then also certain studies have looked at micronutrients, such as sodium or certain vitamins that people have consumed. Today, we're only going to be talking about macronutrients because there's a little bit more evidence and research behind those. So starting off with hypocaloric studies, there was a study that looked at how a hypocaloric diet influences body weight and liver fat. And what this study looked at was about 100 men and women who had an age of 30 to 60 years and had a BMI between 25 and 45. So age range of 30 to 60 is quite big. And then a BMI of 25 to 45, I'm not sure if you're familiar with this metric, but a BMI of 25, as you can see in the bottom left, is the cutoff between normal weight and overweight. And someone with a BMI of 45 is quite obese, and at that point, they would qualify for bariatric surgery. So again, a huge range of people. And what they did in this study is they restricted the amount of calories each person was consuming by 30% for a period of 6 months, and they placed them on either a low carbohydrate or a low fat diet. And the first question I have for you guys is, what do you think happened to body weight? Did it go up, down, or not change? This is going to be a reoccurring question. So as you can see here, on the left is how many calories they consumed. And in both groups, caloric intake went down, as we'd expect. On the right, we're looking at body weight. And you guys can see that in both diets, body weight went down and there was no difference between groups. Perfect. That's what we'd expect. The study kind of worked. What happened to liver fat? Did it go up, down, or not change? And then the second question, was there a difference in how liver fat changed between groups? So in both groups, liver fat went down. So IHL is an abbreviation for intrahepatic lipids. And you can see that irrespective of whether people had a low carbohydrate or low fat diet, if body weight went down, liver fat went down as well. But this is one study. It's sometimes hard to generalize just based off of one finding. So what I've done for you on the next slide is provide a bit of a summary to look at what do hypocaloric diets do in general to liver fat. And what studies have found is that irrespective of if the study is 2 weeks or 7 months long, and regardless of what people consume, if a person consumes less calories than they need, and if they end up losing body weight, liver fat goes down. And as you can see here as well, it goes down by a pretty similar amount, ranging from about 25 to 55%. And I want you to keep that number in mind because we're going to see a bit of a different range coming up. So what we're seeing here is that if people consume less calories than they need, liver fat goes down, and what you eat kind of doesn't matter. What about on the other hand, where we're consuming a hypercaloric diet and gaining weight? Here we're looking at how it influences liver fat accumulation and body weight. And in this study, they took 38 men and women who were aged 42 and had a BMI of 31. It's a bit of a narrower kind of patient population, so to say, where their body masses were kind of just on the cusp of being obese. And in this study, what they did is for 3 weeks, they overfed each person 1,000 extra calories a day. We need about 2,000 to 2,500 calories a day, so it's a pretty big increase. And one group, all the extra calories came from sugars. In a second group, all the extra calories came from saturated fat. And in the third group, all the extra calories came from unsaturated fat. So again, what do you think happened to body weight? Did it go up, down, stay the same? And was there a difference between groups? Exactly. So you guys are getting it. If people consume extra calories, body weight goes up, as you can see in the bottom kind of row of that table. And interestingly, body weight went up by a similar amount in all three groups. So people are consuming 1,000 extra calories a day. After 3 weeks, body weight increased. What happened to liver fat? Again, did it go up, down, or not change? Exactly. So liver fat went up in all groups. So regardless of what people were consuming, if they were consuming extra calories and gaining body weight, liver fat went up. Interestingly, the liver fat did go up by different amounts in different groups, but we're going to revisit that thought a little bit later on in the presentation. So again, this was one study that's overfed people extra calories and liver fat went up. But what have other studies done? So what people have shown is that, again, under hypercaloric settings, when people are gaining body weight, liver fat will go up regardless of the macronutrients or what you are eating. But interestingly, the amount that it goes up varies quite a bit. In some studies, liver fat went up by only about 5%. In other studies, it went up by about 150%. That's a very, very big range. And of course, you can look at it and say, well, some of these studies were for 4 days, other ones went up to about 6 months. But even by those standards, you'd expect a little bit more of a consistent change. So this was a bit weird in the field because if you have a hypocaloric diet, again, what we said, liver fat went down by about 30 to 50%. But under these settings, when you're feeding people extra calories, you have an increase of anywhere from 5 to 150%. That's a really, really big range. And so people were thinking that something else must be going on. And so if we go back to our original slide where we were saying we're going to look at how dietary, nutrient quantity versus composition affects it, people then said, well, what if we remove quantity from the equation and only look at dietary macronutrient composition? So this would be looking at studies under isocaloric conditions, where people are consuming the same amount of calories that they need, And what they did is they varied their macronutrient composition. And kind of as expected, there was no consistent change in liver fat. In some of these studies, liver fat barely went up by 0.001%. In other studies, it went down. In other studies, it went up by 50%. So what this is saying, or what kind of the message that we can take away from this, is that dietary macronutrient composition does have an effect because it's leading to all these different variabilities. But we don't really know what the effect is because we need to be a little bit more specific and not just look at fat as an entire entity or sugar as an entire entity, but break it down into even further details. So we're going to do that next. So we kind of discussed quantity on the left. We're going to now discuss composition. And as you guys earlier mentioned in the chat, we can break composition down into sugars and fats. And then I'm going to say we can break fats down further into saturated and unsaturated fats. And we're going to work through how these different macronutrient compositions affect liver fat accumulation next. So we're first going to look at sugar on its own. So we want to know, how does a sugar-enriched diet influence liver fat accumulation? And there was a study that did this in about 32 men that were relatively young, so an age of 18 to 50, and had a BMI of about 26 to 32, so mostly overweight. And what they did is they gave people a quarter of their total calories as either high fructose or high glucose, so two different sugars, for 2 weeks under isocaloric conditions, so under weight neutral conditions. And then 2 weeks after that, they gave the same amount of kind of energy as high fructose or high glucose, but gave them extra calories so that it was hypercaloric and they were gaining weight. And they wanted to see, was there a difference in liver fat and body weight between these two sugars? So again, the first question I'm going to ask you is, what do you think happened to body weight under isocaloric conditions and under hypercaloric conditions? So we have one person saying they both increased. Do we have any other thoughts? So the way these graphs are organized is that the first black bar is the fructose diet at baseline. The next kind of dark gray bar is fructose after the diet. And then the white bar is glucose at baseline. And the one on the right is glucose post. So you can see under isocaloric conditions, so when people were consuming the same amount of calories that they were burning, there was no change in body weight. Whereas afterwards, under the hypercaloric part of the study, when people were consuming extra calories, their body weight went up. But interestingly, it went up by the same amount regardless of if the extra calories came from fructose or glucose. What happened to liver fat? Do you think liver fat stayed the same? Did it go up? Was there a difference between sugars? So here, if we look at liver fat, again, under isocaloric conditions, you can see that there was no change. So before and afterwards, regardless of what sugars they were consuming, liver fat stayed the same, body weight stayed the same. But under hypercaloric conditions, if we look at liver fat on the right, it went up regardless of if the participants consumed the extra calories as fructose or as glucose. And it went up by a similar amount. So this was a bit of an interesting finding in the field because usually people think that high fructose leads to more fat accumulation and it is worse for you than glucose. And this kind of contradicts that a little bit. However, if we look at our patient population, they're a bit younger than kind of most people with metabolic disease. And also these people only consume this diet for 2 weeks, which is relatively short term. Generally, when we've looked at bigger observational studies, they look at a person's kind of sugar intake over the course of years. So there's a bit of that difference in kind of fructose consumption may explain a bit of that difference. But in general, what we're seeing here is that under weight neutral conditions, the sugars you're eating don't really have an effect on liver fat accumulation, whereas if you start gaining weight, you end up putting on more liver fat. So that's just looking sugars compared to sugars. how does sugar compare to fat? So there was a study that looked at this, and the first one that it looked at was under isocaloric or weight neutral conditions. And what they did is they took 16 men with an average age of about 48 and BMI of about 28, and they asked them to consume for 4 weeks a diet that was high in saturated fat or high in sugar. And then this was a crossover design study. So after a washout period, they took the same people and got them to consume the other diet. So although they only have 16 people, all people consumed a high saturated fat diet or a high sugar diet, and then the opposite one. And the benefit of these kinds of studies is that you can compare each person to themselves, and that helps to account for some variability like their physical activity or their genetics, etc. Again, in this study, what do you guys think happened to body weight following the high saturated fat diet and the high sugar diet? Did it go up, go down, stay the same? So interestingly, because it's an isocaloric study, you would think that weight should stay the same if they're taking in the same amount of calories that they're burning. But for whatever reason, on the right, you can see that participants consuming the high saturated fat diet had a small but significant increase in body weight. So if you go into this paper and look at it, this is likely because foods that are high in saturated fat tend to be very calorically dense, but not very big in volume. So it is likely that these people actually ended up consuming a few extra calories than they need, and this may have led to this increase in body weight. But again, it was over the course of 4 weeks, and they only gained about a kilo, kilo and a half, so it's not a very big difference. On the right, you can see that people who consumed a high sugar diet, there was no change in body weight. What do you think happened to liver fat? Did it go up? Did it go down? Did it stay the same? So if we look at it here, on the left, we can see the people who consume the high saturated fat diet. On the right, it's the high sugar diet. And the people who consumed the high saturated fat diet had a significant increase in their liver fat accumulation that we didn't see in the people who consumed a high sugar diet. And this is interesting because this is the absolute amount of fat in a person's liver. And you can see that it went up from about, say, 4.2% to about 5.8. So that's a very big increase in liver fat over the course of 4 weeks, more than you'd expect for that increase in body weight. So although an increase in body weight will increase your liver fat, you wouldn't expect this big of a change. And what's also quite interesting about this is that the cutoff for fatty liver disease is a liver fat of 5.5%, which is, lower, or people have surpassed on this high saturated fat diet. So it suggests that these people who were consuming this diet, although some people may not have met the criteria for fatty liver disease before the study, after the study, their liver fat would have gone or been high enough to start meeting the criteria for this disease. And that's interesting because this was only after 4 weeks on this diet, which isn't a very long time. Naturally, this is a high fat, high saturated fat diet, so they're probably consuming much more fat than their normal dietary intake. But it still kind of shows that there can be really rapid and large changes in a short amount of time, and that types of foods that you're eating in your diet may have bigger roles than what we kind of care to admit sometimes. The next study we're going to look at, so this one looked at sugars versus fat under isocaloric conditions. I want to ask you then, what do you think would happen under hypercaloric conditions? And this takes us back to the study we looked at previously under the hypercaloric quantity setting. So where we had 38 men and women with an age of 42 and BMI of 31, where they consumed extra calories of sugars, fat, or unsaturated fat. And again, you've seen this before, and we said that, right, people gained weight, liver fat went up. But I think this one really nicely shows that despite similar weight gain in all 3 groups, the amount of liver fat that went up was quite different. In the saturated fat group, their liver fat went up by about 50%, whereas in the unsaturated fat group, it went up only by 15%, and in the sugar group, it went up by 32%. So what this is suggesting or kind of telling us is that irrespective of weight gain or independent of body weight gain, the types of foods that you're eating do play a major role in determining liver fat accumulation. And this is interesting because if we start to look at guidelines for metabolic diseases, very often they'll include information about counseling patients on the amount of food that they're eating, on how to lose weight, but they don't often include information on macronutrient composition. They might say limit your saturated fat intake, but again, not all the guidelines include that information, and not everyone is convinced that it is important. Again, it might depend on what disease you're looking at. This is for liver fat. If you're looking for cardiovascular disease, you might have different opinions. But liver fat accumulation is a risk factor for cardiovascular disease. So it's all entangled and it's all related, and the types of fats that you're eating do end up playing a bit of a role. So we've kind of looked at quantity and composition, and there's a couple more studies I kind of just want to highlight before wrapping things up for today. There's other stuff in the diet as well, and you guys have mentioned this too. There's the amount of water people consume, there's micronutrients, but what about meal frequency? So how often you eat versus something like meal size, how big of a meal you eat. Does that influence liver fat accumulation? Well, there's a study that actually looked at this, and they asked the question of, let's say people eat the same amount of calories in a day. Does it matter if those calories are consumed as 3 big meals, or if they're kind of spread over the course of the day? So essentially we're asking here is, does snacking have an effect? And what they did is they looked at 36 men with an average age of 22 and BMI of about 22.5. So quite young, quite healthy. And what they got them to do is to eat about 40% extra calories. And they gave them this extra 40% of calories as 3 liters of a drink that was either high fat, high sugar, or just high sugar. And they got them to consume this, drink either with meals to increase their meal size, or a couple hours after a meal in order to increase their meal frequency. And they did this for the course of 6 weeks. So all these men are consuming the same amount of total calories, but we've just increased the size of the meal or how often they're eating. And what this study looked at then was their liver fat. Interestingly, there was a really, really big difference in what happened to their liver fat accumulation. Although they were eating the same amount of total calories, and although their body weight was the same, and the composition of their diet and the composition of the drink was the same, kind of comparing the high fat, high sugar to the high sugar and high sugar, if this drink was consumed as a snack, so in between meals, this led to a significantly greater increase in liver fat than if the drink was consumed just with the meal. So this suggests that if you kind of have bigger meal, if you eat the same amount of food, but have them as 3 meals, versus if you have kind of your meals spread out and you snack, this does lead to different effects on your metabolic health and metabolic consequences. And the potential kind of mechanism that may explain this is related to insulin signaling and insulin secretion. So it's thought that for insulin to signal effectively, it's really important that it goes up, then goes back down, goes up, and then goes back down. And insulin is secreted after we eat a meal. So if you're consistently snacking, it's thought that you're always having a little bit of insulin secreted, so you don't get these really nice peaks and troughs. So your body becomes a little bit more insulin resistant because it's always seeing a little bit of insulin present, and you don't get that withdrawal. Again, this study didn't necessarily look at that, so it's a bit of an inference of what might be happening, but they did really nicely show that, again, it's not just quantity, it's not just composition, but also the timing of your food that play a role. So the last kind of study we're going to look at today is a bit of a popular diet, or a popular kind of diet that comes up in social media. And it's going to be the ketogenic diet. So the first question I'm just going to ask, and you can answer in the chat if you want, or you can just answer in your head, is the ketogenic diet good for you? And I'm not going to comment, I'm just going to show you data, and then you guys can make up your own mind. So what is the ketogenic diet? Well, it's a diet where more than 90% of your calories come from fat. So it's a very, very, very high fat diet. When I was talking about high fat diets in the previous studies, all of them were about 50 to 60% of calories from fat. Ketogenic diet is 90% of calories from fat, so a huge increase. And in this study that looked at it, they took 37 men and women that were relatively young, average age of 35, and BMI of about 31. And they got them to consume for 6 weeks a low-calorie diet that was either the ketone diet plus an extra ketone salt. So this is a very, very high ketone group. They had a second group that was a keto diet and a placebo. So this is a medium ketone group, and then a low-fat diet. Or there should be low levels of ketones. And the idea is that if the ketones are doing something special and having this metabolic benefit, there should be a difference between these three groups, with the biggest beneficial change being in the keto diet plus keto salt group, because they are high ketones or have the highest amount of ketones. And there should be the lowest amount of change in the low-fat diet group because they have the lowest level of ketones. And as has been the running theme for this presentation, we're going to look at liver fat as our readout of metabolic health. And what they found was absolutely no difference. Because this was a hypocaloric study, all three groups ended up losing weight, and all three groups had the same total caloric deficit. But the fact that one group had the highest amount of ketones compared to the other group had no effect on how much liver fat was lost. They lost the exact same amount. So this was under hypocaloric settings, just a bit of food for thought for yourselves. What if this study was done under isocaloric conditions or hypercaloric conditions? How would the fat composition of this ketogenic diet impact liver fat? Well, we've kind of seen the answer to this question in the previous hypercaloric studies. If people were to consume a high-fat, saturated fat-enriched diet, this might actually be detrimental to their liver fat, even though they're very, very high ketones. It also may explain why no isocaloric or hypercaloric study has shown benefit with the ketone diet. Again, not a lot has been published, kind of when I went back and looked and I was making this presentation, so things may come up in the future which contradict this, but kind of as it currently sits today, there is no evidence that I'm aware of that shows a beneficial effect on liver fat. So to kind of summarize what we've talked about today is we've looked at how different diets affect a person's liver fat. Under hypocaloric conditions, liver fat went down. Under hypercaloric conditions, liver fat went up. And if we looked at the fats, saturated fat tended to increase liver fat, whereas unsaturated fats tended to decrease or not have an effect. And sugars tended to increase or decrease liver fat, but it really depended on how many calories people were eating. So kind of putting it all together, you can see that when we're looking at a risk factor like diet, there's a lot of things that kind of break down, or a lot of pieces that go into this puzzle, and they affect kind of what our readout may be. And if we go back to that slide from earlier where I was talking about all the different risk factors, a lot of them can be broken down into these kind of more complex webs and nets. So there's a lot of kind of research or kind of reading you can go down further. Even something as simple as smoking or not smoking can be broken down into what did they smoke, how long ago did they stop stop and restart? You know, you can kind of really tease apart these little nuances. And that's for that reason why there's so much research or so many studies in this area, and can make it a little bit overwhelming, because all these different research groups have really fine-tuned and picked apart these various different aspects of metabolic health. But what's still left to know? I think sometimes I talk to people about this stuff and they say, well, don't we know how diet affects liver fat, or don't we know how that saturated fat is bad? And we know bits, but there's still kinds of questions like, does the rate of weight gain matter? We've talked about body weight increase in the hypercaloric studies, but let's say people put on 5 kilos. Does them putting on 5 kilos over the course of 2 weeks versus the course of 6 months matter where that fat is stored? Would more fat be stored in the liver, or would it be stored in the fat tissue? We don't know because these studies haven't been done. Also, I've shown you that different fats have different effects. We know the saturated and the unsaturated, but we don't know why. What happens in the cells and why do they lead to different effects? And then diet is one risk factor, but people are more than the diet they eat. So how does dietary fat composition, for example, interact with a person's genetic background to influence their disease risk? Are there certain genes that kind of save you from a high saturated fat diet? Are there certain genes that exacerbate that and make it even worse? Again, it's to be determined. And then we've been mostly talking about people who are overweight or obese, but people who are lean or have a normal body weight develop high liver fat as well. Why? Why do they develop it? Why? Even if they don't have that extra fat tissue or they're not consuming a hypercaloric diet, Is there something about their skeletal muscle? Is there something about their genetics that causes this lean, fatty liver disease phenotype? These are all things that people are trying to kind of pull apart and understand, and it's where the field is going. If you've been interested in my presentation today, these are kind of things you can go on further to continue reading and continue learning. So as I mentioned earlier, you can kind of try and tease apart and look at the interactions between diet and other risk factors. So how a person's phenotype, so for example, how much body weight they have, what is their insulin sensitivity, how does this influence how they respond to a high fat diet, a high carbohydrate diet, etc. I'd also recommend that you go forward and have a read about how different organs are specialized to handle metabolism after a meal. So postprandial means following food. So what does the liver do versus what does the adipocyte do? What does insulin do in different organs? And how do the different organs in our body come together to orchestrate a coordinated response? And then going finally one level further or one level lower, in cells, what do fats and sugars do? How are they handled differently? What are the metabolic consequences? What are the non-metabolic effects? What do they do to the genetics? There's a whole bunch of research and kind of questions out there that look at the intracellular handling of these constituents in healthy states, but then also in their disease states. And then I'm also going to provide you with a few suggestions of where to go if you want to find this information. So the BBC does have some interesting documentaries as well as interview podcasts with researchers. There are also, with the interviews, I believe the University of Oxford has a number of 5-10 minute interviews with various senior researchers that can be quite interesting to listen to as well, because they'll give you a bit of a highlight of their research and their research backgrounds. There's a few TED Talks that you can listen to as well, and some of them will exist on diet, on metabolic health, on cardiovascular disease, so I'd recommend those. But I think what I also kind of like to put out there is a lot of journals will release these news and views articles, which are really good for the level that you guys are at. So these are research articles that are like 1 to 2 pages, and they're summaries of big kind of impactful research papers that have come out. And they're written in a way that summarizes it and puts together the key findings so that you don't have to go through and try and tease apart, pick apart a really complex 12-page paper. So I put in the screenshot of one that's somewhat related to what I was talking to today, and you can see that it has this news and views kind of label in the top left, and it will discuss a recent research paper that looked at intermittent fasting, for example. So I'd recommend you have a read of those if you're interested in these topics or any medicine topics, because they're a very gentle and nice summary and can kind of be used as a springboard if you just want to learn more about a topic, or if you want to read that before going into the research paper. It just gives you a bit of background to make things easier.